Well, yeah, as we age, so does our smiles, right?
Yes, they do. They do.
Yeah. Yeah. You may not think there's nothing you can do about that, but there is.
Yes, and we have joining us John Heimke of Oral Design Cleveland here to tell us all about how we can liven up our smiles. Thanks for joining us.
Thank you.
Thanks so much for being here. So what can we do to rehabilitate our smiles as we age? We're not aging, but
not at all.
Other people are. Let's just put it that way,
That's
Doctor.
true. Well, unfortunately, we all do age, and our teeth are used all the time, 24/7, and they do start to wear down. They wear down, they change color, they move, we may lose a tooth, and so we're able to rehabilitate it using a full mouth rehabilitation in most cases, either with dental implants or on natural teeth.
Can you tell us more about the dental implants and how that works exactly?
Sure. Let's say you have teeth where then they're kind of on a terminal path and things just aren't getting good.
Not looking good.
Yeah. So what we can do, and I work with a team, with a surgeon in my laboratories, what we do is we take out the teeth and in the same day we place implants and then we place a bridge. It goes from one side to the other. So you're not going to be putting your teeth in jars every night, like maybe a relative that you might have.
On the side of the nightstand there.
Yeah, nobody wants that.
Yeah. All right, let's talk about it because you do call it, as you say, full mouth rehabilitation. Take us on the entire process.
Yeah, so the process, what we do is first off, I study the face.
Okay.
And I look at the characteristics of the face. And then I design the smile. I'll use a process these days called digital smile design. So I can make a 2D rendering that shows the patient kind of where I think the case is going to go. Then we make a sculpture of that new smile in 3D. Patient comes in, we prepare the teeth, they leave with these prototypes in their teeth so we can test the smile. And then about 4 weeks after that, we place the final ceramic into the mouth. It's about a 10-week process total.
So when you say the test the smile, they're going to eat, they're going to make sure everything works properly, and it's a test drive.
Correct, and it lets me see if my vision and with the laboratory, how we're teaming, it all works out. And we can make little adjustments, and then we can go to the final.
Yeah, I think it's awesome. I also love the fact, too, that you look at the entire face. I see people walking around where the smiles just don't match because I call it the banana split smile. Remember that old show where the teeth were huge, and it doesn't fit sometimes.
Exactly. You have to look at facial characteristics. There are asymmetries, in the face and in the smile that we need to work with. There's a strong side and a weak side to the face. And then, the nose position can be off to one side or the other. The chin position, hair color, eye color, all these things have to be put in so that when we create a smile, it's harmonious. It's myself, it's my laboratory, Peter Kavaris in New York, and Pinka Sadar in Atlanta, and be it for implants or be it on natural teeth, we want to make it a naturally harmonious smile so it creates the personality of that person, not somebody else.
Can you show us some before and after, some examples of the work?
Sure. I think we have some here.
Okay, let's do it.
Yeah, so here's a case where we did dental implants. Obviously, you can see there are teeth that are in not the best of shape. They had to be lost on the top. And so on the top there, that's what a prosthesis on dental implants looks like. It's called a zirconia hybrid. And then on the lower, we were able to keep the teeth and put beautiful ceramic crowns there. And as you can see, it's a dramatic difference that we can do. The other thing, too, is we opened what we call the vertical. That means that as we age, we get that kind of grumpy look. So if we can elongate the lower third of the face, we can give you a more vibrant look. I don't want to make someone look like they're 20 if they're 60. I just want to make them look vigorous and vibrant.
And who are we looking at here?
So in this case, this patient's teeth, obviously the age factor came in, and she was just very, very unhappy with her smile. So I incorporated all the things we talked about a few minutes ago, and we designed prototypes, and then this is the final ceramic. And so we opened the bite, we put this beautiful crown and bridge work in, and then we made a shade recipe. It's not just one shade. We use a shade guide. This is my shade guide here that I predominantly use because people want whiter teeth. And we're able then to create that white that is built specifically for that patient.
And I think we have time for one more. Is that right?
Yeah.
One more?
Yeah, here we go.
So this is the patient, and look at on the right. Watch in the next few seconds, the rejuvenation that we were able to accomplish.
Wow.
Well, Isn't that amazing?
It really is.
Because the lower third of the face controls everything there. It's the eyes and the teeth. That's what happens when we engage each other.
It really does.
Perfect.
Beautiful
Well,
job.
thank you. So you can get more information about this at the Facial Aesthetic Designers, Inc., Oral Design Cleveland. They're located at 21851 Center Ridge Road in Rocky River, Ohio, Suite 302. The number's right there on your screen, too. Call 888-255-3588. You can also go on everyonelovesmysmile.com and dental implants, rockyriver.com. So
Dr.
very nice.
Thank you so much.
Always a
Thank you
pleasure.
for that information.
We appreciate
Beautiful
it.
work.
Yes.
So still ahead, Holly has a life hack to help all of us out.
And later, get into the great outdoors, find out how to do it safely and comfortably when we come back.
This segment of Good Company was sponsored by Oral Design Cleveland.